This idea came to me around 2 years back. Since I'm an SICS trainer, I used to train a few residents and fellows. I used to see what struggle they used to have, and whenever I was trying to convince them or tell them some concepts, they always found it a little difficult. They're not able to understand. Sometimes some things were used to be so complex that some diagrams or videos will also be a little difficult. As all of us know, to excel in cataract surgery, we need to understand the concepts and the basics of cataract surgery steps. And we have so many theory, material, diagrams, illustrations to understand all these surgical steps. At the same time, we have surgical videos. However, in certain situations, certain complex, there can be some complex to understand some surgical steps where the animation comes into play. So as all of us know, animation can simplify the concept and the viewer can easily understand. So animations gives the confidence for the surgeon to understand and then operate, and this performance will be greatly improved, and surgical outcomes will also be more favorable. However, to make an animation which is playing on the right side so well, we need to have a good animator, and we need to spend a lot of money, at the same time, a lot of time, and we have to keep explaining the animator that this is the step, that is the step. So that takes lots of effort. So I wanted to try a jugaad way to make a simple animations so that everybody can understand. So there I came into this Microsoft PowerPoint, where I started exploring the various features of this Microsoft PowerPoint, where you can get different features like drawing option is also there. Then we have so much of transition features, especially morph animations. And then we can add so many animations to the shapes and whatever the diagrams we make. So to show a few examples, as we know, this is the crescent and this is the heel. So we teach everybody, all the residents, that it has to be crescent, heel has to be up when we are dissecting the sclera, and it has to be down when dissecting the cornea. So to make it more understanding, as we see that in the sclera, the heel has to be kept up, and as soon as we enter in the cornea, the heel has to be go down. Suppose if we don't follow this, then what happens? It can easily go into premature entry where the iris stays nearby and iris can collapse. At the same time, if we bend it too much, then it can enter too much into the cornea and it can cause buttonholing. So this will make the resident understand, oh, this is the exact concept and why we should do this. Similarly, beginners tend to fail making the side pockets. So the importance of side pocket is not understood because they make an inter dissection and outer dissection, but they don't dissect pockets. So that will lead to a bottleneck configuration instead of a trapezoid configuration, leading to nucleus delivery difficult. So by making a pocket, we can make them understand through this animation that by doing a side pocket, the nucleus delivery becomes smoother. Next, the one more important thing, whenever we tell them, don't inject any fluid or visco when you're within the Sideport wound. We have to always inject when we enter the anterior chamber. So this animation shows that if we inject the fluid within the Sideport, then it can go hit the descending membrane and it can cause descending membrane detachment. Similarly, whenever we're doing a Vectis nucleus delivery, we have to make sure that we have to visualize the inferior edge of the Vectis under the cataract, however the hardness of the cataract may be. So make this concept understandable. If the Vectis is under the nucleus, it is easily visible. If it is not visible, then that means it is under the iris, and pulling it can cause inferior iridolysis. So this animation makes it understand more clear. So there are multiple steps like this, where depressing the lower lip causes wound opening. At the same time, you have to lift the upper lip so that the wound keeps closed all the time. So all these basic concepts can be easily made them understandable once we show all the simple animations. So there are lots and lots of animations I have created, and all these animations are put up in our YouTube channel. Just for the sake of time, I'm just jumping this. So these are the video link for lots of animations which I created and we upload in our AIOCTube YouTube channel. And this is playing as M6 series, and which has almost overall got 1 lakh plus views. And recently, this has been recognized by one of the international sources for SICS, where they have quoted our work, which is uploaded in the AIOCTube, and they've referred this as a source to learn SICS. So in conclusion, PowerPoint animations make it simple and easy to create all these animations. We can do it by ourselves. It doesn't consume much time, and it can be used as slides and converted to videos very easily. Thank you.
Thank you, Dr. Pavan. I'd like to request Dr. Rajshekhar sir to please give your expert comments.
Thank you, Dr. Satyajit. Dr. Pavan, it's a nice presentation.
Thank you, sir.
You're very close to learning animations. That's what it looks like. It's a good tool to teach. But how easy is it to learn this amount of PowerPoint skills?
So it's very easy, sir. We just have to understand how the animations and transition behaves. So most of these animations, what I have made is just slide transitions. That is an option called morph transition. We just have to keep all the things in one place, and next slide, we have to just arrange it in such a way that if you apply morph animation, automatically it will move the time frame.
Where all you can apply this, Pavan?
I didn't get you, sir. Where all means?
Where all you can apply this similar application? Where else you can apply this?
All the surgical steps can be made very easier. I'm working on phaco animations also now. That also becomes more easier, and I'm working actually on glaucoma surgeries since I'm a glaucoma consultant, and it is in the process. Since we have completed making this SSS animations, the next series will be on phaco and the glaucoma surgeries.
See, for me, it will be very useful if a doctor himself or herself can do it so well.
Yes, sir. Yes, sir. Yes, sir.
Is it possible that people can? What's the learning curve?
It's very easy, sir. There are so many YouTube videos available in YouTube videos on PowerPoint. We just have to keep watching 5 to 10 videos, and then we'll become masters. So nobody taught me PowerPoint. I just, we all know that we can make slides, we can present it, but just a little bit exploring of the simple PowerPoint tool can get us all these ideas, sir.
I think Dr. Vinod wants to ask some question. Vinod?
No, it's all right. Yeah. It's
Good
quite
presentation. Sujata.
Dr. Ellen?
Yeah, and Pavan, it was a fantastic presentation.
Okay, Sujata ma'am.
One question is that do you have to do a lot of drawing to get this all these animations done? Do you draw those things?
Yes, madam. It's all there in the shapes option, madam. If you just open up the PowerPoint and go for insert option, there is an option called shape. Okay. So what we can do is we can just combine multiple shapes, and then we can group it, or we can. There is one more option called merge shapes. You can just merge everything and make it into a single shape, madam. It's very easy, madam. If you learn it, it becomes.
How do you apply the animation?
Yes, madam. So what we have to do is, as you see in. Yes, madam. I just.
Yes.
As you saw in the first animation where the crescent was there. So what was that? It was there in the stride position. What I did was I just duplicated the slide. The next slide, I just moved the crescent whatever way I want. So I don't have to do anything else. Then for the second slide, I just have to apply morph animation. So once I apply morph animation, the PowerPoint is so good that it will cause a smooth transition that it appears that it is animated and actually moving. So it's as simple as that.
Yeah, I agree on this. It's a very simple thing. Only thing you have to look on the PowerPoint presentation. There are a lot of tutorials there.
True, sir.
And it's very easy. One thing is the cropping. Crop you can do in any shape. So that helps you to design so many things. You can crop even your picture in various shapes. So that make the things very easy. So using all the shape and cropping, I think you can animate a lot.
Yes, sir.
One point I want to add, not only this drawing part, the drawing has been introduced, I think, only in the recent PowerPoint slides.
True, sir. True, sir.
Shapes and things, what you said, you can do anything with this PowerPoint. In fact, I had created in 2005 or 6, I had created the molecular action of cyclosporine. So anything and everything, not just surgery, it can be created on a PowerPoint.
True, sir. Totally agree with you, sir.
And these are easily available on the YouTube for anybody who wants to learn?
Yes, madam. Yes, madam. For your just as an extra thing, I just want to share. I don't have any financial interest. There are one series run by Mr. Ram Gopal. He runs a channel called Presentation Process. He has 100+ videos. He teaches all these simple things. He doesn't teach about medical things. He teaches in general PowerPoint basics. From whom I learned, I can call it as PowerPoint guru for me. I have 100+ videos of that, which he teaches very simple 8 minutes video each video. We can learn a lot from his presentations.
Even I am following this guy. It's a very good. Yeah.
Yes, sir.
Thank you very much, Dr. Pavan, for that nice